Clearing the air, understanding lung cancer symptoms, risks, and treatment advancements on HealthSphere. Welcome back to HealthSphere. Today we're addressing a major global health challenge, lung cancer. It's a disease that affects millions and is often diagnosed at later stages, making understanding its signs, mitigating risks, and being aware of the latest treatments incredibly important. Recognizing the signs, lung cancer symptoms. One of the difficulties with lung cancer is that symptoms often don't appear until the disease is advanced. When symptoms do occur, they can sometimes be mistaken for less serious conditions. It's crucial to be aware of persistent or worsening changes in your health and discuss them with a doctor. Common symptoms of lung cancer include a persistent cough that doesn't go away or gets worse. This is often the first symptom noticed. Coughing up blood, even a small amount. This is a serious symptom that requires immediate medical attention. Shortness of breath. Feeling breathless during activities you used to manage easily. Chest pain. Pain that may worsen with deep breathing, coughing, or laughing. Wheezing, a whistling sound when you breathe. Hoarseness, a change in your voice. Weight loss and loss of appetite with no known cause. Feeling tired or weak all the time. Repeated lung infections, such as bronchitis or pneumonia, that don't clear up. If the cancer has spread to other parts of the body, it can cause symptoms related to the new location, such as bone pain, headaches, or jaundice. Risk factors. Understanding who is at risk. Several factors can increase a person's risk of developing lung cancer. The most significant is smoking. Smoking tobacco. Cigarette smoking is the leading cause of lung cancer, responsible for about 80% to 90% of cases. The risk is higher for those who smoke more frequently and for longer durations. Other forms of tobacco, such as cigars and pipes, also increase risk. Secondhand smoke. Breathing in the smoke from other people's cigarettes, pipes, or cigars also increases the risk of lung cancer for non-smokers. Radon exposure. Radon is a naturally occurring radioactive gas that can build up in homes and other buildings. It's the second leading cause of lung cancer. Exposure to other substances. Workplace exposure to substances like asbestos, arsenic, chromium, nickel, and diesel exhaust can increase risk. Air pollution. Living in areas with high levels of air pollution may slightly increase the risk. Personal or family history of lung cancer. Individuals who have had lung cancer before are at higher risk of developing another. Having a parent, sibling, or child with lung cancer can also increase risk, possibly due to shared environmental exposures or genetics. Radiation therapy to the chest. Survivors of other cancers who received radiation therapy to the chest are at a slightly increased risk. Quitting smoking. The single most important step, given that smoking is the overwhelming cause of lung cancer. Quitting is the most effective way to reduce your risk. It's never too late to quit, and the benefits begin almost immediately and increase over time. Benefits of quitting. Within minutes, 2 hours, your heart rate and blood pressure drop, and carbon monoxide levels in your blood begin to normalize. Within weeks, 2 months, your circulation improves, lung function increases, coughing and shortness of breath decrease. Within 1 year, your risk of heart disease is significantly reduced. Within 5 to 10 years, your risk of cancers of the mouth, throat, esophagus, and bladder is cut in half. Your risk of lung cancer drops significantly. Within 15 years, your risk of coronary heart disease is similar to someone who never smoked, and your risk of lung cancer continues to decrease, getting closer to that of a non-smoker. Tips for quitting smoking. Quitting can be challenging due to nicotine addiction, but it is absolutely achievable. Here's some advice. Make a plan. Set a quit date and stick to it. Think about your triggers and plan how to deal with them. Seek support. Tell friends, family, and colleagues about your plans so they can offer support. Consider joining a support group or using a quitline telephone service. Talk to your doctor. Healthcare professionals can provide guidance, resources, and may recommend medications or nicotine replacement therapies to help manage cravings and withdrawal symptoms. Consider medications. Prescription medications like bupropion or varenicline can help reduce cravings and withdrawal symptoms. Nicotine replacement therapy. NRT provides nicotine without the other harmful chemicals in tobacco smoke, helping you gradually reduce your dependence. Behavioral strategies. Find healthy ways to cope with stress and cravings. This could include exercise, hobbies, mindfulness, deep breathing exercises, or simply distracting yourself for a few minutes until the craving passes. Remove temptations. Get rid of all cigarettes, ashtrays, and lighters from your home, car, and workplace. Don't get discouraged by relapses. Quitting is often a process. If you slip up, don't view it as a failure. Learn from what happened and recommit to your quit plan. Advancements in treatment. The landscape of lung cancer treatment has dramatically changed in recent years, leading to improved outcomes and quality of life for many patients. Treatment approaches are becoming increasingly personalized, based on the specific type of lung cancer and its genetic characteristics. Key advancements include targeted therapies. These drugs target specific molecular abnormalities in cancer cells that drive their growth. For patients whose tumors have certain genetic changes, targeted therapies can be highly effective, often with fewer side effects than traditional chemotherapy. Before starting treatment, tumors are often tested for these specific alterations. Immunotherapy. These treatments harness the power of the patient's own immune system to recognize and attack cancer cells. Checkpoint inhibitors, a major type of immunotherapy, work by blocking proteins that prevent immune cells from attacking cancer. Immunotherapy has shown remarkable success, particularly in advanced non-small cell lung cancer, and is now a standard treatment often used alone or in combination with chemotherapy. Combination therapies, combining different types of treatment, such as chemotherapy with immunotherapy or targeted therapy with other drugs, is proving to be more effective for many patients than single treatments alone. Proved diagnostic tools. Advances in imaging. Biopsy techniques allow for earlier and more accurate diagnosis and staging. Liquid biopsies, which analyze blood for cancer DNA, are also becoming increasingly useful for identifying genetic mutations and monitoring treatment response, particularly in advanced disease. Advances in surgery and radiation therapy. Minimally invasive surgical techniques reduce recovery time and complications. Radiation therapy has become more precise with technologies like image-guided radiation therapy and stereotactic body radiation therapy, allowing higher doses to be delivered to the tumor while sparing healthy tissue. These advancements mean that treatment for lung cancer is no longer a one-size-fits-all approach. Decisions are made by a multidisciplinary team of specialists, taking into account the patient's overall health, the specific characteristics of the tumor, and the stage of the disease. Conclusion: while lung cancer remains a serious illness, understanding its symptoms, aggressively addressing risk factors like smoking through effective cessation strategies, and being aware of the rapid advancements in treatment are crucial steps for patients, those at risk, and the wider community. Early detection, facilitated by awareness of symptoms and potentially screening for higher-risk individuals, combined with personalized cutting-edge treatments, offers hope and significantly improves outcomes. Quitting smoking is the single most impactful action you can take to protect your lung health and reduce your cancer risk. Support is available, and the benefits are profound. Thank you for watching HealthSphere. Stay informed, prioritize your health, and consult with healthcare professionals for personalized advice. Disclaimer: this article provides general information and is not a substitute for professional medical advice. Always consult with your doctor for diagnosis, treatment, and personalized recommendations regarding your health situation.